Welcome back to the Morning Blend. They are two cancers that are gender exclusive. We're talking about prostate cancer in men and ovarian cancer for women. Reduce the risk by identifying the symptoms. Here with more is Dr. Michael Becker of Urology Specialist of Nevada. Good morning to you and welcome.
Good morning. Thank you.
Let's start with the guys. What exactly is prostate cancer?
So prostate cancer is obviously a disease of men. A lot of guys, I get a question of what is the actual prostate gland. So obviously it's the cancer of the prostate gland. The prostate gland is a gland that is in the pelvis. It is beneath the bladder. It's important in the reproductive system. It's what produces the fluid that carries the sperm and for childbearing and things like that.
Now, who gets prostate cancer? Is there a likelihood of certain men getting it?
Yeah, all men can get prostate cancer. It's fairly ubiquitous. Some say that if you live long enough, you will get prostate cancer. Certainly, there are increased risks in certain populations of men. Men with a family history of prostate cancer and African American men are also more likely to get prostate cancer.
And are there symptoms of prostate cancer that we can be aware of?
Most times there's not. There can be some subtle symptoms. Some men can have some urinary changes. Oftentimes you can sometimes have blood in the urine or the semen, but typically you don't have symptoms. Unfortunately, some men present when the cancer has already spread to the bones, and that's sometimes the very first symptom they have is pain.
Now, if this is hereditary and your father has had this before, at what age do you start screening?
If you do have a family history, you should probably start screening a little bit earlier. Typically, the recommendations from most of the major organizations are to start screening at the age of 45. In men that do have a family history, maybe you should start a little bit sooner just to get that baseline PSA testing.
And that's the conversation you definitely should have with your doctor.
Absolutely. And they still do the digital rectal exam. That's also an important part of the screening test. But if your PSA is elevated, it's important to talk about that with your doctor, probably get a referral to a urologist, talk about the pros and cons of actual further testing, whether you go through a biopsy, because you need to have the biopsy before you can be diagnosed with prostate cancer.
And how else do you screen?
That's really it, is the PSA. Obviously, you're going to do that in men as you're getting older. There has been some controversy in terms of, PSA screening, period. But I think, like I said, most of the major organizations still support routine screening for men beginning at age 45.
Is there a way that men can lower their risk of getting prostate cancer?
Well, routine physical exams are important. Eating a healthy diet, exercise are also very important. Those are probably the most key factors.
It does make a difference.
Yes,
absolutely. And what about smoking? Does that contribute to it or no?
No, it probably doesn't. That doesn't mean that it shouldn't stop.
Right, exactly.
But absolutely.
Well, let's talk about women and women's health and ovarian cancer. What exactly is ovarian cancer?
So ovarian cancer, obviously, again, the disease of the ovaries. Again, ovaries are the part of the reproductive system. There are two. There's one on the right and one on the left. They're in the pelvis. They're important in parts. Obviously, they store the eggs for pregnancy. They also produce important hormones, estrogen being one of those. Yeah.
And what are the symptoms of ovarian cancer? Do women know they have it?
Oftentimes not, and that's very difficult. Some of the major organizations have talked to be very proactive about talking to physicians about being a little bit more in tune with certain symptoms like feeling full more quickly, vague abdominal pains. Sometimes you can have some urinary changes, some frequency, urgency. Sometimes you'll get some bloating. But
and we can blame that on a menstrual cycle, right?
Absolutely.
So it's almost the same, and you wouldn't know the difference.
So it's extremely difficult. There are, in certain populations, in high-risk patients, women that have had a first-degree relative, a family member diagnosed with ovarian cancer, certain genetic syndromes, women with a breast cancer gene or a colon cancer gene have an increased risk of developing ovarian cancer. And then in those populations, sometimes you will do more screening tests for them. You'll do pelvic ultrasounds, or even there's a blood test called a CA-125 that's sometimes can be elevated in ovarian cancer and can lead to a little bit more stringent and more further testing.
Now, is there a way to reduce the risk of getting ovarian cancer?
just like anything else. We don't know of anything specific. Some studies have showed that taking birth control pills, obviously breastfeeding has been another thing that has been associated with that. Still, probably the most important thing is eating a healthy diet, getting regular exercise, seeing your doctor, getting your regular routine exams.
And just like prostate cancer, with ovarian cancer, it's so important to get screened ahead of time and then go see a doctor if you have any problems, symptoms.
Correct. Unfortunately, there's not great screening tests for ovarian cancer. It's a little bit more rare than, say, like a breast cancer where you do mammograms, or like cervical cancer where you're doing pap smears and things like that. So there's not great screening tests for the general population. And also, ovarian cancer tends to be a little less common. Only about 1 in 70 women will develop it in their lifetime.
That's good, right?
Yes,
but
absolutely.
What can we do to lower risk again in that sense?
Again, you know, eating healthy, regular exercise, seeing your doctor on a regular basis, getting your routine exams and things like that.
And this is not a death sentence if you can get it early.
If you catch it early, absolutely not. It's highly curable if you catch it early. Unfortunately, because there's not great screening tests, because there's not really an identifiable symptom that would lead you to an earlier diagnosis, oftentimes 75% of women don't get diagnosed until they're already stage 3 or 4, and then the prognosis is not so good.
Well, doctor, some great information for us this morning. Thank you so much.
You're welcome.
Lower your risk by keeping a healthy lifestyle and get regular screenings. Let urology specialists of Nevada help. They have 3 locations here in the Valley. For more, visit the website or call the number on your screen. They're also on Facebook and Twitter.